Today we'll be performing a closed castration on a male rabbit. A pre-scrotal approach will be used. The incision will go where this black line is, just cranial to the testicles. Ensure both testicles are in the scrotum before proceeding. Advance one testicle to underneath the pre-scrotal incision and excise directly over it. Gently cut through the spermatic fascia. Bluntly dissect with hemostats or scissors to stretch and pull the spermatic fascia apart to start exteriorizing the testicle beneath. A significant amount of force can be used to bluntly dissect, as sometimes, especially in older male rabbits, these tissues are thick and fibrotic. Begin by grasping the testicle either with fingers or a hemostat in one hand and gently stripping away the spermatic fascia with gauze in the other hand. This often takes multiple attempts to strip fascia off before getting the entire testicle out. In rabbits, the inguinal rings remain open throughout life. Gentle traction on the caudal abdomen can ensure replacing the testicle back into the tunic. Strip all excess tissue away from the spermatic cord before placing a clamp. Once again, ensure the entire testicle is present within the tunic and distal to your clamp. Place an encircling ligature over the spermatic cord. Here, we use a modified Miller's knot. We recommend using monocryl suture, either 3/0 or 4/0, depending on the age and size of the rabbit. Here, we're using 3/0 suture. A single ligature is placed over the spermatic cord. Cut the suture tags short to avoid leaving excess suture material, as this can contribute to adhesions and granulation tissue in rabbits. Place a clamp distal to the initial clamp and excise the testicle between the two. Once removed, check for bleeding and replace the stump of the spermatic cord back into the body. Next, repeat for the opposite side. Again, gently incise through the spermatic tissue to start releasing the testicle from underlying tissue. Bluntly dissect down to help stretch the tissues in order to exteriorize the testicle. Strip the fascia over the testicle to help release. In older male rabbits, this can be challenging as the tissues become more fibrotic with age. Do this in small portions at a time in order to avoid ripping through into the tunic. Again, gentle traction can be placed in the caudal abdomen to ensure the testicle is through the inguinal ring and within the tunic. Gently strip down the remaining fascial and fat tissue to clean the cord before placing a clamp. Once ensuring the entire testicle is within the tunic, you can excise and place your ligature beneath. A single encircling ligature is placed using 3/0 or 4/0 monocryl, depending on the size of the rabbit. Replace the spermatic cord stump back into the body and check for bleeding. The incision will be closed in 2 layers, a subcutaneous and a skin layer. Oppose the subcutaneous tissues with a single cruciate or simple continuous pattern, depending on the size of the incision. Here we place a single simple cruciate, incorporating the left, right, and median raphe. Care should be taken not to grasp the skin with forceps, as this can cause irritation and lead to excessive self-trauma. Once tied, do not cut the tag of the suture, as it will be used to tie back the skin closure layer. Begin closing the incision with an intradermal or subcuticular closure. Ensure the needle and suture does not poke through the skin, as rabbits have thin skin and this can happen easily. Once opposed, tie the suture back to the tag from the subcutaneous layer. Cut the tag and smurf the needle to help bury the knot. We place a green tattoo to indicate the rabbit has been sterilized. At House Rabbit Society, we recommend doing this to indicate to all future owners and surgeons that this rabbit has already been castrated and no additional surgery is needed. Afterwards, apply a small drop of tissue glue to both the incision from the prescrotal neuter and the tattoo. Thank you for watching our spay and neuter videos. I encourage you to explore our other resources online at houserabbit.org.